Good morning, and thank you for joining us. With recent developments in the fight against COVID-19 in Cass County, I think it's very important to receive updates from the public health professionals and our local health systems. There has been some confusion in the mayor's emergency orders when the governor published his orders late on Friday night. My amended order for Monday tries to sync up those orders. We have received a lot of calls from the public, and there was some confusion. We're essentially following the governor's recommendations. We saw an increase in number of people in establishments to 150, with a 50% in bars and restaurants. In discussions with restaurant owners, that's very important. The Fargo-Cass Public Health Team wanted to address the issues we're seeing regionally with churches and religious gatherings. The governor, through the state health officer, has put in place a mask mandate, which is a separate order. I hope this helps to clear up the confusion some people may have had with recent orders and why the local order was put in place. Before I begin, I want to acknowledge my fellow leaders, Cass County Commissioner Chair Chad Peterson and West Fargo Commission President Bernie Dardis are on the call today. Thank you both for your leadership and joining us today. I feel it is important to acknowledge the absence of my fellow co-chair of the Red River Valley COVID Task 19, Desi Fleming. She normally provides us with inspiring words and an important public health message. Today, she has prepared the following statement to share. I am sorry I could not attend the briefing today. As you all know, there has been a considerable increase in cases in our community and the state. Even with the most diligent effort, we're continuing to see the spread of this virus. My absence today is due to COVID-19. I've tried my best to limit my potential exposures by practicing all the preventive measures we've been discussing over the past 8 months. Unfortunately, due to the high level of community spread, I was exposed to the virus by someone in my household and also now have tested positive myself. This past week, there have been many statewide mitigation efforts as well as local actions implemented which are shown effective in other states. With these efforts, we hope to see a slowing of the spread in our community, as well as a lessening of a burden to the healthcare system. The winter will be a trying time for a lot of us, especially with the holidays coming up. But temporary sacrifices will be needed in order for us to buy time until vaccines are readily available. Please do what you can do to protect yourself, and all of you care about wearing a mask, washing your hands, avoiding gatherings, and social distancing. This will end, but we still have challenging times ahead. I look forward to seeing you all soon. Be kind and be safe. We all wish Desi a speedy recovery. Please do your part and take her advice so we can slow this virus. Now I'd like to introduce our next speaker, North Dakota Department of Health Field Epidemiologist Brenton Niesemeyer. Brenton will provide an update on the latest case numbers as well as providing data that we need.
Thank you, Mayor, and good morning, everyone, and thank you for having me on today and taking part in this press conference. I'm going to provide just a quick update on numbers. As of November 17th, which was yesterday, we are sitting at 1,524 active cases. That's 1,524, just like to stress that we are over 1,500 active cases in Cass County. Our current rolling positivity rate of 14 days is 16.6%, which is very high. We'd like to see that below 5%. Of our active cases, the most active cases continue to occur in our 20 to 29 population with 428 cases. We do continue to see in excess of 200 plus cases diagnosed a day amongst our residents at Cass County. Our rolling average of new cases diagnosed a day is 246 cases. So we're averaging, for the last 14 days, we're averaging about 246 cases a day who are being diagnosed with COVID. Some of these are mild, some of these are severe. Throughout the pandemic, Cass County has diagnosed 13,783 people, which is a little bit more than 7.5% of our population in Cass County. like our active cases, our 20 to 29 age group has been the most impacted. On a more somber note, Cass County in the past month has passed 100 deaths related to COVID. We are currently at 109 people who have passed away with COVID, which is tragic, just to say the least. 109 people have passed away with COVID. And then we do continue to see a large number of people who are hospitalized in Cass County amongst our residents and outside residents who are hospitalized at our healthcare system, Sanford and Essentia. But I'll let them talk a little bit more about that as they are on this conference as well. You may ask, where are we seeing cases? Where are these cases coming from? Why haven't we seen a decrease? Gatherings and groups continue to be a problem regionally, nationwide, and locally. And it is no different here in Cass. We have seen weddings or cases attributed to weddings, smaller social gatherings such as birthdays, housewarming parties, and dinner parties. We've seen cases attributed to conferences, group meetings, in-person meetings. You know, this is not the time to get together in person for those group meetings, social gatherings. Recently, I came upon a COVID risk assessment tool, and it was developed by Georgia Tech, and it's available online, and be sure to get that shared to all of you. It determines that if within Cass County, I was looking at Cass County today, and if you have a gathering of 10 or more people, the risk is at least 50%, at least 1 in 2, that someone with COVID or someone with an active infection of COVID will be at your group gathering. So you're really flipping a coin when you're hosting these gatherings of 10 or more. And that kind of brings me, you know, this time of the year, it brings me to Thanksgiving. This year more than ever, it's important to keep your gatherings small and intimate, and consider keeping it just within your own household. We want everyone to enjoy future Thanksgivings and family gatherings with all the ones that you love, friends and family. And by keeping it small and intimate this year, we can ensure that will happen. The North Dakota Department of Health recently came out with the risk assessment tool, or RISK, to kind of talk about the risk of acquiring COVID at Thanksgiving. You know, your low risk activities include virtual dinners, an intimate dinner with just your members of your household, dropping off and delivering meals to those who are high risk. So instead of going in and having your grandparents over for Thanksgiving, dropping a meal off, leaving at their door, and waving at them through the window. Medium risk activities include small gatherings of people who live outside your household. So this includes, you know, gatherings of 1 or more family, or 2 or more families, 2, 3 families. And then our high risk activities include traveling out of town, participating in crowded races, parades, participating in Black Friday or Thanksgiving shopping in person. We want you to patronize our small businesses, but continue to try to do that online or at off times when there aren't as many people there to do that shopping. And then just remember, and you know, in order to prevent COVID and in order to mitigate and in order to get our numbers down, remember to socially distance, wear your mask in public, and then stay home when you're sick. And most importantly, get tested if you're feeling unwell, just so that you know and that your family knows whether or not they need to quarantine. Thank you, Mayor.
Thank you, Brenton. I'm afraid I'm not going to get Grandma and Grandpa's famous turkey this year. So, in this pandemic, we get questions about the health systems, and we hear things every day, every week about what's going on, capacity issues within the hospitals as well. So I'm very pleased today that we have two physicians that are going to help explain this and help us to understand what their capacity is and what we can do in the future. First, we have Sanford Health VP and Medical Officer, Dr. Doug Griffin.
Thank you, Mayor, for the invitation. Good to see people virtually again. I'd like to say our hospital is incredibly busy. In the last few weeks, we've experienced the highest number of patients, both with COVID-19 and overall, since the beginning of the pandemic. The overall number of patients in our medical centers in Fargo continues to stay consistently well above 500, with more than 100 of those patients being treated for COVID-19. In the spring, we averaged just about 25 patients with COVID-19 per the day. So as such, Sanford has activated our next stage of our pandemic surge plan. The plan focuses on three areas: expanding our bed capacity, evaluating non-emergency surgeries, and reassigning staff to balance our overall needs. Some of the initiatives we've taken include triaging all non-emergency surgeons. Physicians are talking with their patients to figure out the best plan of care for them. Asking retired employees to work if they are able and willing. Training non-clinical employees to help with tasks that don't involve patient care, such as answering phones and delivering supplies. Even a CMO can deliver PPE on the COVID unit, I learned. We're also securing more traveling employees than ever before. Overall, we have 120 travel nurses on contract for up to 13 weeks. 40 of those have actually extended their contracts to stay longer with us, and we're very appreciative of that. 10 more started this past Monday, and 50 will start later in November. The quality of our care and the welcoming environment we've created for these travelers is providing a place that they want to work. And we're optimistic about the impact of a safe and effective COVID-19 vaccine, with just further announcements coming today from Pfizer, and are working hard on distribution plans. In fact, we are ready to accept the vaccine at any time and begin vaccinating appropriate people. However, we simply have to reduce the need for hospital beds. It will be quite a while before the vaccine makes an impact, because our hospital and the hospitals across the nation really are full. There is nowhere else to go. We can all do our part, as Brenton aptly pointed out, to reduce the pressure on the healthcare system by practicing social distancing, wearing a mask, washing hands frequently, avoiding those gatherings, as was pointed out, and following the guidance from the CDC. They really have also a very nice information about the Thanksgiving holiday as well. And also extremely important to get your flu vaccine. It's up to each of us to take the responsibility we need and to do our part to stop the spread. Our hearts ache for the patients and families that have lost loved ones and are struggling with COVID-19. We're doing everything we can for them. We're so grateful for our physicians, nurses, and other staff who continue to work long, hard hours and provide outstanding care to all our patients with kindness and compassion. We know the situation now is even more challenging, so please join me in thanking them and supporting them in any way you can. Thank you very much for the time.
Thank you, Dr. Griffin. And from Essentia Health, we have Dr. Rich Vetter.
Great. Good morning, Mayor. Good morning, everyone. As we've been discussing, the pandemic has entered a new phase within our community. Our community infection rates, hospitalizations, and ICU patients are at an all-time high. We at Essentia, along with the other healthcare organizations, are doing all that we can to meet this demand. The critical need that we really have right now is our staffing. We've been doing a lot of time and doing a lot of planning, looking at our space, our supplies, and our staffing, and our biggest need is really our staffing. We have a number of clinical care staff who are out due to high-risk COVID exposures, and the vast majority of those exposures have occurred within our community and outside of activities related to patient care. The absence of these colleagues places a burden on the remaining staff to meet the needs of our patients. As Dr. Griffin said, we've also at Essentia gone out and hired some additional staff, traveling nurses and other support staff, to provide relief for our existing staff, which has been very much welcomed. As healthcare providers, we've done many messaging to educate our staff and the public on the need for proper masking, physical distancing, avoiding gatherings. And we ask the community to continue to support us in these efforts. I want to do a thank you to Mayor Mahoney as well as Governor Burgum for their supports in these efforts as well. As I said, at Essentia, we've been at or near capacity for the past 4 weeks. This is due to increases in COVID cases, but also an increased need of acute needs of our patients, as well as transfers from organizations and locations outside of our historical referral base, particularly from the western part of the state where they've been at capacity as well. One of the challenges going forward also will be that of available, timely testing. We have initiated this week to provide some additional ease for our patients to access testing through what we call a patient-initiated testing, where they can actually go on if they have a MyHealth or MyChart account and actually order or request a test on their own. They'll be given a time, they drive up to the testing site, have the test done, and then the results are communicated back through their MyHealth portal. For other individuals, we continue to offer our eVisit portal as well, where people can access testing through the eVisit portal. The other thing that we initiated this week is saliva testing. You may be aware that other public health departments and others have opened up saliva testing throughout our communities as well. We will be offering this in Duluth, Brainerd, and Fargo. Started, as I said, this past Monday. The turnaround time for those tests should be about 2 to 3 days, which is also a welcomed relief. The results will be interfaced with our Epic health record. So again, the information will be available through that portal. We were all very excited this week to hear the news of a possible vaccine or vaccines that will become available that show efficacy up to 90 to 95%. We are also working with the state health departments on both the Minnesota and North Dakota side to assist with distribution, storage, logistics, prioritization when those vaccines are available. There's no denying that we are incredibly busy, yet we don't want to paralyze people into fear with a sense of panic. It's vital that patients continue to seek the care they need. So if they're experiencing an acute issue, just chest pain or heart attack, we ask them to reach out to our emergency department. Chronic disease, continue to manage those with your primary care physicians and clinicians, as well as preventative screenings. I think part of the reason that we're seeing an increased number of patients is because of some of that delayed care that we had earlier in the year. So we want to make sure that we're addressing those health needs as well. Finally, as healthcare providers, we cannot fight this pandemic alone. Now more than ever, we need the help of our friends, neighbors, community members to do all they can to slow the spread of this virus. As was mentioned, by practicing good hand hygiene, physical distancing, masking, and avoiding large gatherings, we can all do our part to reduce the stress on our health systems at this time. I also want to do a thank you to our staff, physicians, staff, nurses, and community for all you're doing to help us as we continue together to work through this pandemic. Thank you.
Thank you, Dr. Better. Mayor Dardis or Chairman Chad Peterson, do you have any questions of the health systems? I see you shaking your head, but I know Chad, our deputies and such stuff need to check sometimes for COVID, and I think we've worked out a system for that. I want to close by thanking everybody for watching and for all the participants in today's briefing. The coming weeks are incredibly important in the fight against COVID-19. We still have the opportunity to mitigate the spread of the virus and save lives as we do so. The power is in the hands of the people and their decisions. Please keep us safe. Thank you.